Hey Central Virginia, Dr. Keith Lynch here. Today we're going to talk about natural solutions for peripheral neuropathy. And we're going to focus on a couple things here. We're going to talk about what is peripheral neuropathy, what causes it, and what can be done to help improve function to those nerves. Now, peripheral neuropathy is very common. It affects like 20 million Americans, and it's a breakdown in the nerves. So when we talk about nerves, oftentimes we'll refer to those as like the wiring through the body. And the wiring is what breaks down, and that wiring connects your brain to your feet. Now, peripheral neuropathy also can affect the hands. Typically it's the feet, but it also can affect the hands. Peripheral means furthest away from the center. Neuropathy means nerve pathology. Now, 10 signs of peripheral neuropathy, you already know these because you're watching this because you or someone you know has peripheral neuropathy, and you know there's burning, cramping, sharp electric pain, pain when walking, difficulty sleeping from leg discomfort, prickling, tingling, loss of balance, weakness, swelling, and numbness. Everybody has different combinations of what they feel because of the nerves that get affected. So you've got nerves that are sensory, nerves that are motor, and autonomic nerves which go to organs and blood vessels. So if you're having sensation problems, if you're having burning, numbness, tingling, it's most likely coming from a motor nerve, a sensory nerve, excuse me. Whereas if it's weakness, then you're having effect from the motor nerve portions. So when we do an examination, we're always testing all the different nerves to make sure they're working properly. Now, peripheral neuropathy finds itself in a category of chronic conditions that we see commonly, and they're because of a combination of different factors, both metabolic factors and neurological problems. So the metabolic factors we're going to talk about in just a few moments. Neurologically speaking, we're saying that there's a problem where the brain, the neurons in the brain aren't firing properly, and they're receiving poor information from the periphery, and that's what causes the imbalance. And typically we see it's mostly a neurological problem, but there's a significant portion of it that's metabolic, and that needs to be addressed as well, or you don't see the changes that you're looking for. Now, when I say metabolic, excuse me, what I'm referring to is your metabolism is based on how well you turn food into energy, meaning energy that your cells can use. 30% of our energy goes to what system? Goes to the nervous system, the brain, the spinal cord, and all the peripheral nerves throughout the outer portion of your body. These are the leading causes of peripheral neuropathy. Statin drugs, damage to the nerves, diabetes or insulin resistance, chronic inflammation, and chemotherapy also can affect those nerves. So we're going to look at each one of these in detail. Statins inhibit the formation of cholesterol. Cholesterol is what makes up that sheath on the outside of the nerve, and statin drugs also decrease your body's ability to make CoQ10. CoQ10 is necessary for your nerves to function. So if you're taking statin drugs, you're breaking down the sheath around the outside of the nerves, and you're decreasing your body's ability to take in CoQ10, which is necessary for your nerves to work properly. There's a 1,600% increase in your developing peripheral neuropathy if you're on statins. That's just, I mean, you're taking something that's causing peripheral neuropathy. That's terrible. Your medical doctor should talk to you. You should talk to your medical doctor about that and see if there's any way you can get off it, because although there may be some risk depending on your family's health history, you're definitely going to get problems from this. And cholesterol really isn't the problem in heart disease. It's inflammation and high cholesterol. That's what the studies are showing. because we've got countries with chronically high cholesterol that do have lower heart disease rates than we have here in the United States. That has to do with diet, and we're going to talk about that coming up. So cholesterol, that's not really the problem. But getting back to peripheral neuropathy, stenosis, bulging discs, arthritis in the lower back, they lead to one thing, and that's damage up here at the lower back affects the nerves going down to the legs and feet. We see it all the time. Diabetes and insulin resistance. Your nerves need glucose to operate. As a matter of fact, some of your nerves need even more than others to work properly. And insulin is what puts glucose into the cell. And if you have diabetes or insulin resistance, that's the part that's not working properly. So the nerves aren't getting what they need and they misfire. And that's where the numbness, the burning, the pain, the weakness, the tingling, that's where it all comes from. If you have chronic inflammation, we have to address that. And there's several ways we address it. We're going to talk to you about using some natural anti-inflammatories to reduce chronic inflammation. But I got to tell you, if your diet is creating inflammation, what do you think would be better to do? Take anti-inflammatories to reduce the inflammation, or change your diet and take some natural anti-inflammatories? Because it's the second thing that we do here in our office. And take-home message on this is, if you're going to work with me to improve how those nerves are functioning, you're going to have to change your diet and remove inflammatory foods. So that means we're going to get rid of wheat and gluten, we're going to get rid of dairy, we're going to get rid of soy. And you're going to have more of what we call a paleo-style diet. There is a side effect to this. Most of my patients lose weight, get more energy, and feel better. That's a side effect I'm willing to take a chance with. So if you're going to work with me, you're going to have to change your diet. No further questions on that. Also, by doing that, we'd look for hidden gut infections, poor omega-3 to omega-6 essential fatty acid ratios. We're also going to check for high insulin and hormone imbalances. And we're going to do that because we're going to look at your hormones. We're going to do comprehensive blood work to find out what's happening in your case. Because there are several factors that affect how well your nerves are working. Now, most people when they come in here tell me the same thing. My doctor already did blood work and everything's normal. Well, first of all, if you think your lab ranges are normal, that's actually not accurate, because what you're getting most of the time is this. You're getting a functional neurological, you're getting a reference range versus the functional optimal range. Now, what do I mean by that? That means if your thyroid stimulating hormone comes back between 0.3 and 5.7, your doctor's going to say, that's normal. I'm going to say, according to the functional ranges, it's not normal. It needs to be 1.8 to 3.0. So if this is a bell curve, we want to get the sweet spot in the middle. Once we start getting those outlier numbers, either high or low, the doctor calls and says, hey, your lab works fine. A couple numbers are a little high, but everything looks good. Those high numbers, they show us trends. They show us areas where your body's not functioning properly. Remember, you got the blood work in the first place because we thought something was wrong. We need to really look at that blood work like a detective and see what it's showing us. You can't wait until numbers are way out here and expect things to be able to change. In our office, when we look at patients' blood work, we look at this yellow range here and we talk about ways of driving that back to the functional optimal. Because I'll tell you, when your numbers are in here, you're going to feel better. Incidentally, all these numbers come from the Endocrine Society. So we're not just making these functional numbers up. They've been verified by other doctors around the country. Now, what happens when your brain can't communicate properly with your feet or your hands? Particularly if you lose it in your feet, you're going to have loss of balance. It'll start to create memory issues, depression, anxiety, Alzheimer's, dementia, and insomnia are all what this study shows happens when you start losing sensation in your feet. Now, if we want to talk about fixing things, we've got to start talking about how things really work. So your nerves need glucose and oxygen, and we've got to reduce the inflammation, and we've got to give it activation. So if the nerve isn't getting activated, it's not going to work. So here's an important point. You right now, if you have peripheral neuropathy, may have pain, burning, tingling, pins and needles in your hands or feet. And you're having it right now. And I'm telling you that your nerves aren't working right. You're thinking, well, they've got to be working right because I'm feeling pain. There's two different sets of nerves sending information up to your brain. In health, large diameter afferents move faster and get to the brain first. Small diameter afferent nerves, which carry pain and temperature, are slower. Large diameter afferents are the ones that have the myelin sheathing around them. So what happens is in peripheral neuropathy, either due to inflammation or statin drugs or those other things that we talked about, the sheathing breaks down around those nerves. Inflammation, reducing blood flow to those nerves, causes them to die off and stop working properly. Now, information from the small diameter afferents in your feet are driving up to the brain constantly uninhibited. That's probably why you do better when you're walking around and doing things, and then if you sit still or lay down at night, now all the information coming up to the brain is pain. So how do we go about improving that situation? Well, here's one of the first things. Patients always ask me, what is it you do that helps a condition like that? I got to tell you, there's not one individual thing. Several things done together will drive this thing in a better direction. Now, HAKO-MED microcurrent. This is a form of horizontal microcurrent. So it does several things at one time is what we mean by horizontal. It promotes microcirculation to the large diameter afferent nerves, supplying more oxygen and nutrients to those nerves. Remember, we want to get them to heal. We want them to get what they need to repair the myelin sheathing and to start sending nerve impulses properly again. It also stimulates that nerve. Remember, we said it needs fuel and it needs oxygen. So here's your fuel, here's your oxygen, because large diameter afferents are part of your pain inhibitory pathway. Think about that for a second. If you whack your elbow, your funny bone, on something, what's the first thing you go to do with it? You immediately reach for it, you grab it, and you rub it and you move it around. Because joint position sense, moving that joint, light touch, some compression to the area, are all large diameter nerves. And you're unconsciously stimulating those, trying to beat that pain signal from going up to the brain. Next time you whack yourself, try not to touch it. It will hurt. And then immediately go ahead and grab it and see how that pain level changes. And then let go of it again. It's exactly how this whole situation works. You have a pain inhibitory pathway, and in peripheral neuropathy, it's breaking down because of several different things. And sometimes it could be more than one thing for one individual. So you need a doctor who's going to be able to look at all those different areas and say, okay, we've got a problem here, we got a problem here, we got a problem here, and we've got a plan for each of those problems. And I'm standing in front of you saying, we do that. That's what our office does. If you come in here and you've got issues like this, we're going to help those nerves heal, because HAKO-MED horizontal microcurrent works like watering the roots of a plant and placing it in sunlight at the same time. Imagine that. If you took a plant that wasn't getting what it needed and it was looking all shriveled and not looking good, and you gave it the nutrition it needed, you watered it, and you gave it the right amount of sun when it needed it, what would happen to that plant? It would grow, it would do well, and it would thrive. And what I'm saying is that's what's not happening right now with peripheral neuropathy patients, and that's what we're offering to do, is improve that nerve function. What else do we do? You know, I know a person out in California who's got several clinics. All they do is help people with peripheral neuropathy, and this is their go-to. This is it. They do very little else other than change your diet and they see great results. In our office, we do several things all at the same time because I want to make sure this is going to work absolutely perfect. And we use cold laser because cold laser stimulates those nerves and it improves circulation. Same thing we're talking about with the HAKO-MED, except it does it differently and it's a different modality. And the cool thing is that we can apply both of those therapies at the same time to drive those nerves to working properly again. What else do? We do our HAKO-MED horizontal microcurrent. We do our class 4 cold laser. We also do vibration, and we do a rebuilder therapy. So the rebuilder, it looks like that. It's something that you actually would apply to those nerves to stimulate the large diameter afferent nerves. Once again, we're going after those large diameter nerves, the pain inhibitory pathway nerves, and this is something that you can do at home. It's part of this program, and you can do it a couple times a week while you're sitting there watching TV. You hook it up, you're barely going to feel it, and it works. And that's why we do it. And you continue to do that even after you finish your program here so that that area stays healthy. We also talked about using some natural anti-inflammatories, which in this case would be essential fatty acids, to give you a better balance of omega-3 to omega-6 essential fatty acids to reduce inflammation and promote healing. Also, when we do your blood work, we'll look to see if there's anything else that would be necessary to help improve your nerve function. Now, the key points as we get close to wrapping this up. Many different things are necessary to help somebody with peripheral neuropathy. It's not a simple situation. Not just one thing will do it. You've got to address both the metabolic and the neurological aspects of it. The condition's progressive. You should know that by now if you've had it long enough. It starts small. It can be intermittent at first. It becomes constant and chronic, and then it starts to grow. Oftentimes it'll start in the toes and feet, go up into the ankles, start affecting the wrist and hands. Our peripheral neuropathy program is very comprehensive. I feel it's state-of-the-art, and I think it really helps a lot of people. What we do is we'll do comprehensive blood work. You're going to have to get on an anti-inflammatory diet, and then we're going to stimulate those nerves and help them work better using all those things that we just talked about. Now, how bad are you? Why don't we find out? What we're going to do is this. My offer is to do a neurological exam where we do what's called Toronto scoring. So a normal score should be 74. And what we'll do is we compare parts of the body that work properly down to the affected areas, whether it's the hands or feet, and we're going to get a score when we're done. And my understanding is that when you get below a certain score, it's too far gone. And if normal's 74 and you're below a 10, I don't believe we're going to be able to help you. So why don't we find out? I'm offering for you to come in and get that examination. If you call 434-245-8456, my staff will set you up with an appointment. Tell them you've watched this video and that you want the peripheral neuropathy evaluation. And this is what you'd get. On your first visit, we'll do that neurological exam. We'll review any existing labs that you have, so bring them in. You're going to fill out a metabolic assessment form, and you should have your spouse or significant other with you. On the second visit, if I feel like I can help you, I'm going to go over the whole program with you. I'll have it all written out, what I recommend. We'll have a review of what we found on the first visit. We'll talk about what the treatment would be, and we'll also talk about what the investment would be. Once again, I recommend you have your spouse with you or your significant other. And this is why. If you're coming in here and you're going to change your diet and you're going to spend money to get this condition working right, don't you think your spouse is going to need to be with you to help make that decision? They're going to want to know what we found. If you come in afterwards and we get to this point and I give you this information, you go, well, I don't really know. I need to go home and talk to my spouse. I'm going to pull my hair out because I'm telling you now, you're going to need to have your spouse with you. It's a big decision.